Hello guys, hello family, hello friends. This is Dr. T and welcome to Clinical Medicine with Dr. T. So guys, in this video I want us to talk about a UTI. Urinary tract infection. Specifically UTI in pregnancy, right? In pregnancy. You know, I'm sure most of you know that for the past 12 weeks I have been working in maternity. I've been working in maternity, and I mean, in maternity, maybe I'm going to talk about a video. I'm going to do a video, not talk about a video. I'm going to do a video where I talk about what were my primary responsibilities as a doctor who's working in maternity. But what I want to say in this video is that when I was working in maternity, I saw a lot of urinary tract infection patients. I saw so many pregnant women who come in with UTI. So it's commonly known as UTI. So I saw a lot of these patients, and the irritating thing about UTI is that, firstly, the most common infection in pregnancy is UTI. The most common infection in pregnancy is UTI. The irritating thing about UTI is that it keeps bringing patients to the doctor. And most of them, because it's irritating, like the symptoms are so irritating, that you will seek medical attention. And for the primogravidas, I mean, they would think that they're actually going into labor. Then they would come in, prepare everything, prepare for the baby, carry clothes to the hospital and all that kind of a thing, only to diagnose them with a UTI and you send them back home. And so it just keeps bringing patients back. There are so many patients that you would see at the clinic who just have UTI. So I felt, since it's the most important, since it is the most common infection, I thought it's worth talking about it, right? So when we talk about UTI, we are talking about infection that affects the urinary tract. Now, if we draw our urinary tract like that, this is our left kidney, and then on the other side is our right kidney, and both of our kidneys, they deposit the urine into the bladder and out through the urethra. So, like I said, these are the kidneys, this is the ureter, this is the bladder, this is the urethra, right? So when we talk about UTI, we are talking about infection on one of these organs, one of these pathways for the urine. Now, as we all know, the inflammation or the infection of the urethra is called urethritis. And the inflammation or the infection of the bladder is known as cystitis. And the infection or the inflammation of the ureter is known as ureteritis. And lastly, infection of the kidney is called as pyelonephritis. Pyelonephritis. Sorry about this. Pyelonephritis. Now, when we say UTI, when we diagnose a patient as having UTI, we are not being specific, because UTI is this word or phrase, urinary tract infection, is an umbrella. It's an umbrella term. Yeah, it's an umbrella term. So it can mean any of these, right? But what is important is to know that the urinary tract is divided into two. If you make a line here, you will divide the urinary tract into two. The lower portion is known as the bladder, and the urethra is known as the lower urinary tract. And the ureters and the kidney known as the upper urinary tract. Let me just do it like that. Upper urinary tract. Why is this important? It's important because if you diagnose a patient with upper urinary tract infection, basically we are talking about a sick patient there. So it's a sick patient, and it's not just a UTI. It's known as a complicated UTI. Complicated UTI. Specifically, the one that is dangerous is pyelonephritis. So if you diagnose a patient with just bladder infection, cystitis, urethritis, that's just an uncomplicated UTI. It's important to know this because the medication that is used, the management differs. I mean, a patient who's got a complicated UTI most likely will need admission and an extensive workup. Will need some imaging and that kind of a thing. But someone who's got an uncomplicated UTI, these patients can be treated as outpatients. So it's important to realize a toxic patient from a non-toxic patient. Okay, so now that we know all of this, let's move into the causes. What causes UTI? What causes UTI? So basically, you have what mic will I use? So basically, you have an infection. So the causes, let's talk about the pathogens. Pathogens. Most commonly, it's your bacteria, and also you also get fungi as the cause. But a fungal UTI is common in patients that have got some kind of immunosuppression. But bacteria affect both the immunocompetent and the immunosuppressed. So the most common cause, or the most common bacteria, are your gram-negative bacteria, like your E. coli. E. coli is responsible for about 85% of UTIs in general. But you also do find some stuff. Let me just finish with the, sorry about this, let me just finish with the gram-negatives. You can also get your Pseudomonas, Enterobacter, and others. Now with the gram positives, your staph, not staph aureus, but staph saprophyticus. So you've got staph here, saprophyticus or saprophyticus, depends how you want to say it. So staph and also some strep pneumoniae commonly. So those are your bacteria and others as well. But I mean, 85% is E. coli, guys. E. coli. And then when it comes to the fungi, it's your, I mean, you know, Candida is always the culprit in this when it comes to fungi. Candida albicans and Cryptococcus neoformans. You also get your Aspergillus species, right? So now that we know the pathogens, now let's talk about how does the infection occur. So usually the infection is ascending. It's an ascending infection. So you get some bacteria that have colonized the perineum, that have colonized the perianal area, and they start now to move up the urethra and cause urethritis. And if they continue to go up, they will get into the bladder and cause cystitis. If they are allowed to go up, they'll go up to the ureters and go to the kidneys and cause pyelonephritis, right? So if you understand this part, you will also understand that, like I said, these bacteria, especially E. coli, it's a normal flora of the GI. So it's found around the anal area, the perineum, and all of that. So now, the minute you move it to the urethra, it starts to cause problems. But it remains a normal flora of the GIT, right? So, this is how UTI occurs, right? Now, I am going to talk about UTI in non-pregnant women, UTI in the pediatric population, UTI in the male or in the male population or in males, and talk about the differences, right? But here I'm going to talk about specifically in pregnancy. So all women, they've got a risk factor for UTI, or they've got risk factors so if you were to put a male and a female, don't say, I don't know if there's a difference between this, but this is gonna be our female. It's gonna be our male. So if you were to put it, a male and a female, the one who's likely to get a UTI is a female. Females are at a higher risk of getting UTIs than males. And why is that? The first reason is that females have got a short urethra. It's easy. I mean, let's draw this. Let's draw this. I want to show it. If this is a male, let's say this is a male, and his urethra is this long, and a female's urethra, let's say it's up to here. Can you see the difference? Now, even if the male, the bacteria, they start to to enter the urethra, it's going to take the bacteria very long to get to the bladder and cause cystitis, right? And like I said, the most common type of UTI is cystitis. So for bacteria, they get to the bladder very quickly than they would or than they do in males. That's the first reason, right? The other reason is that females, the distance between the anal canal and the urethra is quite short. So the proximity, so there's a short distance between the anal or the perianal area and the urethral opening, right? Like we said, that these bacteria, they actually stay around the perianal area, you see. And women, when they wipe after they've helped themselves, when they wipe, this practice of wiping from the back to the front actually removes these bacteria from the back to the front. That's why the advice is that when females wipe, they must wipe from the front to the back, right? So that's another risk. Let me just say hygiene practices, right? That's another reason. So the anatomy of the female and the male, the anatomy of the females puts them at risk of getting UTIs. That's why when a male hardly gets a UTI. When a male gets a UTI, there's usually a problem, a more serious problem that you need to address. So diagnosing a male as having UTI is questionable. There's a reason why they've got a UTI. Because anatomically they are protected. But we are going to talk about UTI in males on another video, right? So there are other risk factors as well, like your spermicides. Spermicides, they actually mess up with the normal flora of the perineum, the normal flora of the vagina, the normal flora. So they just mess up with the normal. And if your normal flora, which protects you from invading bacteria, is messed up, is destroyed, then you are prone to the infection from the other bacteria. So spermicides, and also when you don't, I don't know how I'm going to put this, but when you don't, I don't know how to put this, but basically what I want to say is, when your voiding pattern, if you take longer to go and urinate, you put yourself at risk of getting UTIs. How? Remember, if you are having a bacteria that is ascending, let's remove this, yeah? Sorry about females. If you've got a bacteria that is ascending, if you urinate every 2 hours, when this bacteria tries to climb, urine will come and wash it away. So every 2 hours, you're actually washing your urinary tract. Every time you urinate, you're actually washing everything out. So if you take longer to actually void, you put yourself at risk. So imagine if you can take 4 hours, 5 hours without urinating, you put yourself at risk because you already have these other factors that are against you. So yeah. Another reason, they also say that if you don't go and pass urine after having sexual intercourse, puts you at risk. So I'm just gonna put this like that. I'm very tired, guys, and I'm also very, I don't like writing. I rather explain things than to write. Okay, so those are the risk factors. I'm sure there are others as well. So these are the reasons why a female is at risk of getting UTIs. I mean, if you've got 10 males, 2 males might be at risk of getting a UTI out of those 10. But in females, about 6 or 7 females, if you put 10, about 6 of those is at risk of getting, is gonna get a UTI basically. It's gonna get a UTI. So that's how it is. So now that we know what UTI is, how it happens, and the risk factors, now let's talk about the management of UTI.